So far this year, there have been more than 410,000 lab-confirmed cases of influenza, already outstripping last year's record high of about 365,000. Meanwhile, vaccinations have been going down. Only 1 in 4 children between 6 months and 5 years of age were vaccinated in 2025. That's the lowest rate since 21. A 60% rate for over 65 marks a 5-year low as well. More than 17,000 cases of flu were confirmed in the first half of October, double those recorded in the same period last year. Now, we like breaking records when it comes to the sporting field or scholastic achievements, but the current flu numbers are breaking records, but not in a good way. Just how concerned are you of the numbers that you're seeing at this time of year?
Yes, I think this is a bit of a catastrophe, actually, because we're used to the flu season ending around about the end of September, but we're seeing that there are still ongoing new cases occurring in the community. And this is because we are seeing slightly different behaviour from these strains of influenza, but also it speaks to the dwindling protection in the community from participation in vaccination. And we know that there are vulnerable people in the community who, when they become infected with influenza, they do worse. Certainly that is the older people and that is children, and they are the populations we really want to participate in vaccination. So these stats are very worrying.
Yeah, we'll get on to vaccinations in just a moment. When it comes to the flu that you're seeing, is it more strains of A or B, or what is it?
It's a combination of strains. Certainly A often will lead the pack, but there is a combination. We get a lot of our information from sentinel sites that provide data and from laboratory confirmed cases, but in actual fact the 410,000 cases that we've seen reported would really be a small percentage of what is actually happening out in the community. We know a lot of people get influenza and don't have laboratory confirmed cases recorded by the government. So in actual fact, this is a much bigger public health issue than even those stats suggest.
Anecdotally, it seems like there's a lot of school kids away with flu, plus workers. We just need to look around the office here. What cohorts are you seeing those being impacted?
No cohort is spared, and that's the thing that we sometimes overlook, is that any person can get influenza, and the fact that you may not have had influenza in years does not mean that you are protected from not getting it at any time. The best thing that you can do to protect yourself from influenza is to be vaccinated, and also to engage in hand washing and wearing a mask, etc., when you're around people who may be infected or travelling on public transport. So everybody is at risk of influenza, but we know that certain populations get sicker when they get the disease, and that includes people who are immunocompromised, who live with chronic medical conditions, older people, and of course young children.
Let's go to the vaccination rates. What numbers are you seeing right now, and what are the trends?
So unfortunately, children have really dropped off. They're down to about 25% participation rate, and that's a real concern, because perhaps we have some mixed messages out in the community. We know that children often won't get as severe COVID, but we don't want people to conflate those two viruses. So we know that influenza in children can put kids in hospital and it can actually take their lives. So we don't want people to forego vaccination against influenza, even if they've gotten into the habit of not vaccinating their kids against COVID. The same with people who are older. We know that we want all of our older Australians to be protected from influenza, but the numbers have started to dwindle for the first time in a long time. And if you end up in hospital or ICU with influenza, you are not the same person when you leave hospital as you were when you went in. So the best thing to do is to not get the disease in the first place.
So what action, finally, Anita, would you like taken? What steps can the government do?
Look, I think after COVID, I think we really just need to make flu shots free for everyone. People got comfortable with the idea that when there was an important public health issue, such as COVID, the vaccines were free. Getting people to go back to many people in the community having to pay for the vaccine, they may no longer be willing to do that. So we know that influenza vaccine is free for vulnerable populations, including young children, but we also need to cocoon our populations by vaccinating everyone. everyone. So I think that really needs to be a public health measure that is considered very seriously, because we need to recognise that people's vaccine behaviours have changed as a result of their pandemic experience.
Dr. Anita Munoz from the Royal Australian College of GPs, thanks for your time.
Pleasure.